Hey, everybody. So let's just take a second. I'll let you guys get in here. I know I always say that at the beginning of every live, but that's literally what I'm doing at the beginning of every live. So have a lot to talk about. I do want to recap last night and then kind of bring you up to speed on the things that have happened today and the things that I have shared and some other things that are also happening and transpiring. So hey, Roger. How is everybody? Hey, Lori. Hey, Patricia. You guys good? Hey, LaDonna. Hey, Daryl. It's been an eventful day on my page. So you guys have had a lot to say today on a variety of issues. So I waited until later in the day to share the information about the cancer treatment facility. Hey, Christy. Let's see, you're back in the land. Yeah, the snowpocalypse. Hey, Martha. Hey, James. Hi, Sarah. Hey, Leslie. What's up, Jamie? So, you want to hear some good news, David? What's up, Heather? How are you? Hey, Teresa. So now that it seems like we've got some folks in here, I'm going to go ahead and get started. You guys can continue to share. We can continue to talk about some of these things. I do want to start with last night. So thank you. Thanks, Roger. I do appreciate that. Hey, Whitney. Okay, so just briefly, if you have not seen it, Tim Mullen was really exceptionally generous, and he took last night. We were at the Washington County, Virginia Board of Supervisors meeting, Dr. Spivey, Tim Bradshaw, and myself, and we were there. I think the meeting was a little bit over 2 hours long, and he came in and he just cut our portion down, and he put that on a video and sent it to me. So I did post it last night. If you haven't had a chance to look at it, it is about 33 minutes in length. Dr. Spivey is around like the first 20 minutes or so. Hey, Suzanne. Dr. Spivey is about the first 18 to 20 minutes or so. I'm after that for about 10 minutes, maybe 12 minutes or so, and then Tim Bradshaw kind of rounded us out. So it's well worth it. The information. So if you have been struggling to wrap your head around the trauma distinctions, you really should listen to what Dr. Spivey shared, because he broke down so easy, so simple for you to be able to understand exactly what these different trauma level distinctions are and why they are so significant and why they truly do matter. So if you have not seen that, do yourself a favor, go peep the video that I posted sometime around like 1 o'clock this morning and check that out for yourself. So I did do a NICU portion last night. As y'all know, that's near and dear to my heart. And one of the things that I have chosen to focus in on the NICU issue is the area of NAS that we have. We have a lot of NAS babies, and we have a lot of premature births and things of that nature. So I did cover all of that. I'll be doing that again tomorrow night in Wise County, and I will be doing that on Monday in Hawkins County as well. So I will tell you this. I know that Ballad is doing everything they can to get ahead of this thing and to get into the ears of council members and commissioners and things along those lines. And so this is the only thing that I'm going to say in response to that, right? Make sure that your council members and your commissioners know that you voted for them in, and you can vote their asses out, and that you will hold them accountable, because that's what's necessary. You know what I mean? So, people kind of have to pick and choose where they're going to fall down on the side of this thing. And so, I think it's important for you. So if you have a board meeting coming up, or a city council meeting that's coming up, whether that's in Wise County tomorrow or whether that's in Hawkins County on Monday, it's a worthwhile effort to pick up the phone and call your councilmen and women and call your board of supervisors folks and let them know that you expect for them to represent your best interests, and you expect for them to dig for truth and dig for details and to look beyond a glossy, great sounding marketing plan and have some meat to what they're saying. So, it's your responsibility, folks, to make sure that the people that you chose to represent you, or the people who are representing you, whether you chose them or not, they are now representing you. It's your responsibility to make sure that they do it to the best of their ability and with your best interest at heart. So if you have meetings coming up, I encourage you to do that. The second piece of information that I want to just throw out there very quickly is the Holston Valley Medical Center NICU and Labor and Delivery is up and running, folks. They are staffed. They have nurses. They have doctors. They have neonatal specialists there, and you have patient choice. So if you are getting ready to deliver and have a baby, if you are high risk, if you have any of those things and you want to be transported, that is a level 3 NICU operating right now. No one can take that away from them. No one has approved that to be taken away from them. So you get to choose. So if you want your baby to be born at Holston Valley Medical Center, then damn it, demand that. Because I surely would. So you do have patient choice. Make sure that you exercise that. Okay. Wise County is tomorrow night at 6 o'clock. So please make sure that you are there. I did post a link up earlier with all the information. So be there. I'm going to be there as well. I'm actually hitching a ride because it's up in the country and that sort of thing. But I want to dig right in. Because here's one of the things that I really want people to understand about what is happening with this COPA, with Ballad Health, with your healthcare. Right now, the only changes that they have really pushed and made an announcement on are these trauma centers and the NICU, right? However, that is not the only changes that they are making. Changes are being made by leaps and bounds in a lot of different areas. And it's one of those things where, my neck almost breaks when I'm trying to go here and here because they're trying to do so many things at one time. And it's hard to stay on top of everything, which I think is kind of their strategy. You know what I mean? So I want to break this down. And for a second, I want to talk about cancer treatment facilities. I want to talk about the Southwest Virginia Cancer Treatment Facility that is in Norton. And I also want to talk about Allendale. So if you saw my post that I put up earlier about 2 or 3 weeks ago, I told you all that I had talked to someone who gave me a lot of information about Allendale and the fact that those patients were being moved to Indian Path in an effort to get 340B pricing. So I'm going to break this down for you, and we're going to go step by step through it, and we're going to talk about what's changed at the Southwest Virginia Cancer Treatment Facility, and what's happening now, and what's the benefit to Ballad. Okay, so if you have questions, I really do want them, but here's what I'm going to ask you all to do on this live. I'm going to ask you to not make comments that you're speculating about what they are going to do and what they aren't going to do. Don't throw out your theories. Don't throw out your conjecture. Don't tell me what you heard when you went and got your hair done. Like, I want you to stay focused on the facts and the things that we know are actually happening and the things that we have documentation to back up, because those are the things that are tangible, that give the state health department, not that I really believe in them too much, but that give the deputy attorney general something to actually go on. I posted that up and people wanted to know, well, where's that at? And is it here? And is it there? And is it true? And is it going to be this? And are they going to do that? And it was, number one, it was a lot of stuff that didn't even matter. Okay, so I'm going to ask you guys to really stay focused on what matters, because it's really easy to run down a rabbit hole when you start to think about all the things that are going on, because there is a very incestuous relationship between Ballad Health and a lot of the companies in this area, with a lot of the banking in this area, with a lot of the politicians in this area. So while sometimes, you go, oh my God, they're connected to this and this and this and this and this. We got it, right? But we want to focus on the connections that actually matter. The connections that could be violations of the COPA, the connections that could be violations of the law, the connections that can be conflicts of interest when it comes to our politicians and bills that are being passed, legislation, things of that nature, right? So ask yourself this, when you get ready to ask a question, ask yourself, is it relevant to what we're trying to accomplish? Because if it's not relevant to what we're trying to accomplish, don't ask it. I know you might be curious, Google it, or just, I don't know, something else, because we really want to focus on the things that matter in terms of healthcare and what we're trying to accomplish for people's well-being. Okay, because I've literally gotten emails from folks who are no longer going to be able to afford their care with these changes that are being made, and people are looking at dying, people are looking at getting ostomies and things like that, and that matters. So let's focus on those things rather than he said, she said, and what they could be doing and who's kissing whose cousin. You know what I mean? Okay, so now that I've covered all that, let's dig right in. Okay, so I want to talk about 340B pricing and what that means. 340B pricing is something that comes from Medicaid, Medicare, and TennCare. So here's what you got to realize about this area. 70% of the people who are insured in this area are insured through TennCare, Medicare, Medicaid. It's government insurance. So what does that mean? That means that Medicaid and Medicare often pay the hospitals and the doctors either like at the rate or slightly below. So the hospitals don't make a lot of profit off of that. So what they rely on are the other people who have commercial insurance, which is only about 25% of this region. The other 5% are non-pay. So when Ballad Health tells you that they do need to streamline and that there are concerns about money, that's relevant, right? I get that. However, I do believe, and the FTC believed, that there were ways to save these hospitals and to save our services without it being at the expense of the public and without even this merger, as a matter of fact. So, but we have it. So we're here. So let's talk about what's happening. So 340B pricing is something that comes from Medicare or Medicaid. And it's when you achieve, you have to have like 11.75% of what's of your numbers fall into this category. It's like a rural referral service. I'm not going to go too deep into this, but here's what you need to know. When a hospital meets this qualification of 11.75%, they get 340B pricing. 340B pricing gives them a 35% discount off of everything in the facility, not just their stuff for the cancer treatment, not just the stuff for, you know, biologies and infusions, right? But for everything. So think about, okay, let's say that you go to Indian Path for a procedure, or for whatever, you go to the ER, they write you a prescription. You take that prescription to the pharmacy that's right there in the hospital and you get it filled. Well, they get a 35% discount on that. We are literally talking about millions upon millions upon millions of dollars in the long run by getting this 340B pricing. Well, how do you do that? You start to have more and more services done at one location or one entity in multiple locations, which is what's about to happen in Greenville, Tennessee. And then that helps you qualify for this 340B pricing. So here's what they've done with Allendale. Thank you, Jeff. My heart really does go out to you. I just want you to know that. My heart really does go out to you. So here's what happens, folks. So the folks who have been going to Allendale for their treatments, whatever kind of infusions, those, maybe it's Remicade, it might be their chemo, whatever it is that's happening there, that's what we call a physician-based location, right? So it's a 42-chair location for 78 patients. And when folks go there, all they're paying is the normal copay of about $20, okay? So you go, you get your treatments, and let's just say you get one treatment a week. Some people get way more than that, but let's just say one treatment a week. So you pay 20 bucks, 80 bucks a month, you're done, okay? Well, now that they're moving this into Indian Path, and here's what I want you to understand. They have not submitted, as far as I know, from everything that I've checked and been told, they did not ask the COPA for approval for this to be approved. The COPA does not even know that it's happening. I believe that they do know, even though it's not official. And I'm going to tell you why I think that in just a minute. So here's the deal. So they've started building this facility, as you could see from the pictures that I posted earlier. It is about 70 to 75% complete. It is scheduled to be done January 20th and open for business January 21st. The problem with that is the COPA has not approved it. State Health Department, Attorney General's office, nobody said, hey, yeah, Ballad, go ahead and do this. Now, what you have to understand is what it means to you, what it means to your family members and your loved ones, is that when you go there for treatment, you now have a facility fee. That facility fee is around $130. Thank you, Stephen. It's about $130. So you have your normal copay of $20, your facility fee of $130, and now every time you go for treatment, it's $150, okay? So imagine, let's just say you're doing that once a week and you do it for a month, 150 bucks, 4 times a month is $600 a month. Now, if you just stop right there, how many people do you know who have an extra $600 a month? Well, technically an extra $520 a month because they're already paying $80. How many people do you know with an extra $520 a month just laying around? Not too many people that I know of. I want you to think about this. Rogersville has a poverty rate of 30%. Don't knock it over, baby. It's grandbaby. This region has a poverty rate of 20 to 40%, right? So how many people that have a poverty rate like that have an extra $520 a month? They don't, okay? So let's just say you're doing chemo and you're doing chemo for 12 weeks. Guys, do the math. That's $1,800. Who has that just laying around? Now, this is where it gets even worse, okay? So one of the other things that Ballad has adopted, okay, one of the other things that they've adopted is a prepay for your radiology. Now, what does that mean in terms of this? So if you're a cancer patient, and let's just say you need to get your PET scan done, right? You need to get your PET scan, your CAT scan done, and you go to have that done. Your average portion of that, right, that the insurance doesn't pay might be around $400, okay? So just follow me on this, folks. So now you're going to have $1,800 per quarter, right, for those 3 months of treatment, and another $400 to see if that treatment worked. If you don't have the $400 to see if that treatment worked, you can't have the testing done. Well, if you can't have the testing done, then your oncologist cannot they don't, number one, know whether to change your treatment, keep doing your treatment, and they can't justify to your insurance company whether the treatment was working, not working. Should they change it? Should you stay on it? What should you do? Well, then what happens if they can't justify it to your insurance company? Your insurance company decides they're no longer going to cover it, period, because they don't know if it worked. What if all of that happens? People will die. That's just the bottom line. And before they die, they will feel helpless. They will feel powerless. They will feel sick. They will feel horrible as people. They will have no quality of life. And then you want to talk about the opioid addiction and the opioid crisis that we have in this community. What do you think will happen if people can no longer go to the doctor and get pharmaceuticals to feel better and to deal with their pain? They will resort to the street. This is just real life, folks. This is real life, and this is what's happening. Okay, so I'm going to keep going. Oh my gosh, I have lots of notes that I want to talk to you guys about. Now, when I brought this up 2 weeks ago to Larry Fitzgerald, this is not the first time your girl has talked about this. I talked about this on a live, and then I actually talked to Larry Fitzgerald. Now, if you remember who Larry Fitzgerald is, that is the state-appointed COPA compliance officer. This is the guy that's supposed to oversee the COPA, okay? Now, this is what he said to me. He said to me that there is a condition that Ballad Health will allow you to make up to 225% of the poverty line. And if you make less than 225% of the poverty rate, then you don't have to pay these fees. Now, listen to me, y'all. Listen, I want y'all to stick with me because this part is important. This part is important, so stick with me. Okay, are y'all listening? So here's the thing. When that sounds great, like when he said it to me, I was like, well, let me see what that is, okay? So let me just tell you what that means. If you're one person, if you're a family of one, if you make more than $27,315 a year, you will be responsible for all of those fees. What's up, Roland? All right, you will be responsible for all of those fees. If you are a two-person household, if you make more than $37,035 a year, you all cannot make $20,000 each. If you make more than $37,035 as a two-person household, then you are responsible for all of those fees. If you are a three-person household, if you all make more than $46,755, you are responsible for all of those fees. If you are a family of four, and your family of four makes more than $56,475, you are responsible for all of those fees. So when Ballad Health acts like they're doing you some big favor because we will allow you to make up to 225% of the poverty level in order to not make you die for your chemo or for your MS treatments or for your Remicade, they're not doing you a favor. It's BS. It's a smokescreen. It doesn't matter. Y'all got that? Anything. So let me just say this, guys. I do want to share this with you. If you have documentation, whether those are emails, whether those are memos, whether those are pictures of your facilities, I have a secure email address. You can message me and I will give you that secure email address for you to send to me. I will absolutely do that. And what I will tell you is that I'm sending that information to the Deputy Attorney General's office. I talked to her for almost 40 minutes night before last. Okay? So, and one of the things that I will tell you is I don't give out people's information. I've told county commissioners, I'm not telling you who sent me this. I'm not forwarding you this from someone else. I've had people ask me for things, and it's not that I don't trust those people. It's because I promised that I wouldn't. I have messages right now. Baby, where'd my phone go? Here it is. So I have a message tonight. And so get this, just the facility fees for this new cancer treatment center at Indian Path is going to bring in $2.5 million. $2.5 million. Because there's $130 in facility fees per patient. You got an average of 70 to 80 patients per day. That's $75 times 130 equals $9,750 times 5 days a week. That's $48,750 times 200 times 52 weeks per year. That is $2.5 million. And that's not including the money that they're going to make because of the 340B pricing that they will get. So when Ballad Health says to you, it's our community, we care, I again say, liar, liar, pants on fire, I don't believe you. And it's not even, so here's the thing, it's not even that I don't believe you because you have a medical monopoly. It's not even that I don't believe you because of Alan Levine's history at HMA. It's not even that I don't believe you because your CEO has been caught lying in mid-sentence on 60 Minutes. I don't believe you because your actions say different than what your mouth says. That's why I don't believe you. Call me crazy, but I watch what you do, not listen to what you say. And that's what matters. So let me just tell you something, this same email, and I have gotten this, let me just be clear. I have heard this now from 3 separate people who heard it happen in this discussion about this change and what was happening. Hold on one second, and I want to just kind of make sure that I quote it right. When this discussion was happening, and they were talking about this move and all of this, this is what a member of the Ballad management team said with regard to this. She opened her mouth and she said, cancer care is not a patient right. That's what they said. Cancer care is not a patient right. And I've heard that from 2 people that I've exchanged with enough to trust, and a 3rd person who just was like the icing on the cake and confirmation. So these are the folks that are running things. And this is all I want you to understand. Now, I want to talk about the Southwest Virginia Cancer Treatment Center, okay, in Norton. So here's what happened. So the pharmacy at that cancer treatment center was a Wellmont pharmacy prior to this merger, okay? So listen, prior to the merger, that was a Wellmont facility and Wellmont pharmacy. Hey, what's up, Tim? But the overseeing pharmacy was Misha, Mountain States, okay? And Grandbaby wears tutu phone, right? Now, here's what happened. So this pharmacy was going through their medication list and wondered what happened to several medications that they normally fulfill at the cancer treatment center were no longer on the list. And when they inquired, when they called the higher level pharmacy, they were told, and one of the medications was Remicade. And they were told Remicade is no longer going to be offered because it is no longer formulary. Now, my understanding of formulary is that means they somehow get either a generic version of it or a discounted version of it. But now that Remicade is no longer on formulary, then this cancer treatment center was no longer going to have it anymore. Hold on, let me just say I'm on live. And when this person was asked repeatedly, well, why, this person replied back and said, I'm tired of people asking me questions that make me look stupid. The bottom line is there's no more Remicade. Hey, Terry. And this is what this person that said, because they said, well, what about the physicians? And she said, listen, then their patients can just go somewhere else to get it. Now understand, that somewhere else would be Withville. That somewhere else would be an hour away. That's what this somewhere else would be. Give me 2 seconds. Someone sent it to me. So this is what happens all day long. So all day long, people are sending me things. And here's what I love. I love the fact that you guys have gotten brave. I will tell them your story, Jeff. Okay, so Jeff is in this room, and he commented on the post earlier today, and I'll let him kind of clarify and go into it a little more. But here's the bottom line, is he used to not have a copay, and he's on Remicade. And now he does. His Remicade is now costing him $900 every other month, every 2 months. Okay, $900 every 2 months. He can't afford it. So because he can't afford his Remicade at $900 every 2 months, he is going to have to get an ostomy. I don't know if you guys have ever. Okay, so my last 6 months that I lived in Charlotte, the last 6 months that I lived in Charlotte, North Carolina, I brought 2 homeless guys to live with me. I did a lot of philanthropy work there, free hugs, and used to take out supplies once a month, like sleeping bags and hygiene kits and all of that. And in the last 6 months that I was there, I brought 2 homeless gentlemen to live with me, one of which was very sick. And during the 6 months that he lived with me, Mike went through 5 surgeries. And the very first one was an emergency surgery because his colon ruptured. And so he had to have an ostomy. So the ostomy, guys, is the ostomy is where they cut the hole. And when they cut the hole, basically your colon is sticking out. Your stoma is what they call it. It becomes a stoma. And basically you're pooping through the hole, like it's out here, and you poop through the hole into the bag, okay? And so for 6 months, for 6 months, almost 6 months, I cleaned poop. I changed ostomy bags and all of that different stuff. And it's very, let me just tell you something. When I was caring for Mike, baby, hold your cup. He doesn't hear me. So when I was caring for Mike, it was very embarrassing. It was very, it's very tough for folks who have an ostomy. Because I mean, that's one of the most private things about you, right? And it's out there for the public to see. And Mike used to be, and like if it leaks and all these other things, it's just embarrassing. And so, this is what some of the people are being forced to deal with in their choices when it comes to care. Because of these changes, it is very dehumanizing. Thank you, Patricia. Thank you. It's very dehumanizing. And it's embarrassing, and it's just self-conscious. And he used to feel bad when I would go to change his stuff. He would feel bad because he would say, "Here, baby." He would say, "I'm sorry." And I would say, "Why are you sorry?" And he would say, "Well, it stinks. You're welcome." And I would be like, "Well, honey, everybody's shit stinks." And I would just try to make light of it because it was so overwhelming, and it was so, dehumanizing and embarrassing for him. So, I get it, Jeff. And that's why I said, as soon as you said that to me, I said, "I'm so sorry." Because it's just not something that you really want to endure in life if you can keep from doing it. You know what I mean? So, well, he can't afford the $900. So when you change facilities, and go to different locations, so let me explain. There's physicians-based, and then there's hospital-based. And I want to make sure that I kind of get this right. Okay, so listen. So when it comes to when it's a hospital-based facility, it's when you're within 250, don't quote me guys, but it's like 250 feet or yards from the hospital. It's one of the two. Okay, so basically when you go to a facility, my understanding is there's a facility that some people have got to go to now that's behind Indian Path. And if it's close to the hospital, if it's within a certain amount of a certain distance, it's considered hospital-based, even if it's not inside the hospital. Now, the new facility is obviously inside the hospital. Okay, so that's the difference. It changes how it's billed. It's even so, okay, let me put it to you like this way. When you get put into the hospital, right, and they give you an aspirin, it's going to cost you a whole lot more than the aspirin that you buy and take it home. It's the same thing here. That there's a whole different rate that they charge when it's a hospital-based medication, hospital-based infusion, hospital-based treatment. All of that makes it different. And that's what's happening to people. Now, the thing that's infuriating about that is we live in a region where most people can't afford this. So not only do you have to worry about dying or being sick or being in constant chronic pain, or, you know, your muscles not working the way that you want them to, now you have to worry about being denied care or being denied tests that you need to see if your treatment is working, right? Well, Jeff has been moved from different facilities, and that's what's changed in his costs. So not this particular, but he's going to have to move again. So, and let me tell you, nothing has passed, Sonia. This is important for people to know. There's nothing been passed because the COPA, this has not even been submitted to the COPA for approval. Now, like I said, unofficially, when I brought it up to Larry Fitzgerald, he brought up that 225%. But the bottom line is that still nothing, you know? So that's what you have to understand. Right, Haley, $50 for baby aspirin. So here's the thing that I want you guys to understand about this COPA, okay? Because a lot of you have commented and said things like, well, the COPA's been approved, the merger's happened, da 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 da. I want you all to understand that. Thank you, Natasha. Okay, so what I want you to understand is this COPA is a living, breathing thing. Okay, it's not something that was done one time. Okay, yeah, nothing has passed, but they started building the facility anyway. That's the thing. The facility is 70% complete, and they haven't even asked permission to do it yet. That's how confident they were that they could just sneak it on through. Okay, so here's the thing. The COPA is a living, breathing document, and it will, as long as it exists for these 10 years, it can be modified and it can be terminated. The key to this, folks, and this is why I have to be really clear with you guys, the key to getting the COPA either modified or terminated is to be able to prove beyond a shadow of a doubt that there is a greater disadvantage to the public because of this merger and the lack of competition and the lack of your choice to go somewhere else for your care than there is for the merger that's taken place. So in other words, Ballad and Ballad Health existing, is it more benefit to you than the disadvantages that you're experiencing? And I would say no, right? I think so too, Patty. And so what we have to do, but we need documentation. So like me getting those pictures today, great job, right? But the other things that some of you all know about that are happening, things that are being done, when you have a patient experience, guys, if you are being taken, if you say that you are going to one facility for treatment and they take you to another facility that you didn't ask for, then I need to know that. You need to be asking for your EMS trip tickets. You need to be asking for your medical records. You need to be asking for your discharge papers, all of your consent forms that you sign. If you are being put into the hospital and they're over testing you, if they are billing you for things that haven't been done yet, any of these things, guys, these are the things that we need documentation of. You need to send me your information. If you have been getting infusions, right, at Allendale, and now you're having to go and get them at the facility that's behind Indian Path, and your costs have gone up significantly, what I need are your before bills and your after bills. Those bills are important because cost of care is one of the things that's covered under the COPA. Your cost is not supposed to be going up in an exorbitant amount. So those are the things, but you do have to send it to me. You can't just tell me your stories. I've got a lot of stories. A lot of people have told me things, and I empathize with you and I sympathize with you, and I wish it was different for you, but that's not anything that I can take to the Deputy Attorney General and say, open an investigation because Sally said that this happened to her, which Sally is just a fake name that I threw out there. But that's not what gets things done. It is documentation. It is proof. It is evidence that this is what is occurring, which is going to require for some of you all to be brave. That's what has to happen. Ask for your information. I have been told that the portal has changed and you can no longer get your entire breakdown of your bills online. You need to go and actually request them. You need to go and request them. Request your entire medical records, including your consent forms, request your bills, request them itemized. That would be amazing, Jeff. Send them to me, because I'm happy to take this information when it's actionable information. So that's what I keep saying to you guys. It's not that I don't care about the other things, because I do, right? But here's the thing. I have to make the most of the time that I have to devote to this. And I have to make the most of the time for the people who are actually listening. We do have the ears of some people right now. There's a lot of attention being given to this. So it's important to maximize it while we have it. And I can't do it with rhetoric and stories and, you know, this happened. No, you need to show me what happened so that I can give that information to someone else. Got it? So that's what has to happen. I want to be very clear about that. Now, I'm going to talk a little bit more, not tonight, but a little bit tomorrow night. Maybe Friday night, because tomorrow night I'll be in Wise. But I'm going to talk a little bit more about your awesome, Leanne. Yes, send them to me. Here's the thing. Okay, so I don't want anything from like 10 years ago, okay? But here's what I want. I want before Ballad merger or before the change in your service. So for example, if you used to go to Allendale for your infusions or your treatments, and then 3 months ago or 2 months ago, they told you that you had to go to a facility that is behind Indian Path. And now the cost of that treatment or the cost of that infusion has doubled or tripled or quadrupled. That is what I want. I want the itemized bill for your treatment since you've been at the new facility, and your itemized treatment since you were at the old facility since the merger. Got it? So we want to be able to show that these things have changed and that there's a direct disadvantage and there's a direct negative impact to the patients and to the public. Now, I will tell you this. The people who have shared information with me are people who are risking a lot to do so, okay? And those people are doing it because they care. So I think it's very important when we talk about Ballad that we don't just say Ballad as a whole is the devil, because Ballad as a whole is not. Ballad as a whole is still made up of the same amazing doctors and the same amazing nurses and the same amazing staff that it was, right, when it was Wilmot and Misha. These are the same people who loved and cared and have taken care of us. They're under different management, and they're scared and they're being threatened. And so they're trying to make choices between being there for their patients and taking care of their families. So it's important to understand that when they risk things to send me documentation and to send other people documentation, not everybody that's Ballad is bad, right? So like my NICU nurses, and yes, I call them mine, they are Ballad, but they are not bad. They're amazing, incredible people who love babies, and they're fighting for the right to help save babies' lives, right? So I want to be able to make that distinction. You know, so if you were to start to ask me, what's a compromise? So we do have to look at some things long term, right? Do we try to undo this COPA in its entirety? Do we try to bring in independent hospitals, or do we try to make them sell off some of the hospitals? What do we try to do? My first thing would be is to get rid of some of these CEOs, right? So for me, Lisa Carter, bye. For me, Alan Levine, bye. For me, Tony Keck, bye. Like there's some of y'all that as part of any compromise long term would be the dismissal of some of that leadership team who is obviously making decisions, making choices, and digging in their heels at the expense of the people who in this region who matter, right? So that would be my first thing is, okay, so we need to take a look at who's here and see them go. Same thing with that raggedy board of directors that we have, right? So I would want to see some more physicians in there. I would want to see even some nurses even, right? I would want to see some of those things take place so that you have a board that is made up of people who understand healthcare and not just business, right? So it needs to be both of those things combined together. For me, if there was going to be a compromise where the NICU is concerned, the NICU would stay at Holston Valley as a minimum of a level 2 if it doesn't get to remain a level 3. Because as a level 2, it can still take care of all of our NAS babies, the respiratory distress babies, as well as all of our premature babies that are not very low birth weight babies, right? So that is a must. The second, hold on a second, my phone is blowing up. The other thing that would take place, so for me, Holston Valley Medical Center would stay the trauma, it would stay a level 1 trauma, not Johnson City Medical Center, right? Number one, Johnson City Medical Center is not the centralized location. And while the COPA says that Ballad has the freedom to determine where that is, it needs to be in Holston Valley if you truly have everyone in the region's best interest at heart, right? So that needs to happen. Bristol has to stay a level 2. It's the closest thing that Southwest Virginia has to any trauma center whatsoever. The second thing that I would look at is getting some sort of trauma center in Southwest Virginia. Even if it's a level 3, give them folks something, because they have nothing right now in terms of trauma. They don't have trauma and they don't have NICU. Lee County doesn't even have a hospital. Shame on Ballad Health that they don't even have a hospital, right? You ditch this idea of pediatric trauma centers. You ditch this idea of pediatric emergency rooms. You build 2 pediatric urgent cares that are more feasibly staffed. You build those 2 pediatric urgent cares that are equipped to take care of the 20,000 pediatric ER visits that we have. Those pediatric ER visits are because we are in a poor rural community, and some people, that's what they use as their doctor. They're not truly pediatric ERs, period. There's no ifs, ands, or buts about that. Your pediatricians have already been telling you that, Ballad. So you might want to listen to the folks that work for you who have the expertise that you seem to not have and don't care about. You take the extra money that you would have spent trying to hire pediatric trauma surgeons and building pediatric emergency rooms while you're busy hollowing out other hospitals that we already have, right? You take that extra money, and then that's what you use to build up the existing programs that we have, right? To bring in more nurses to this area, to bring in more education, more prenatal programs, more OBGYNs in the area. All of those things are the things that need to be done. See, here's what we have a choice. You have a choice to make a hospital profitable either on the back end when people are already sick, when people are already ill, when people are already dying, or you can make a hospital profitable, believe it or not, helping people get well. There's a ton of government money out there when it comes to the opioid crisis that's going on. There's a ton of government money out there when it comes to NAS babies. There's a ton of funds that are available that we could do. You could save our hospitals without sacrificing our communities if you choose to. And that's the question that I would pose to Ballad Health is, how do you want to save our hospitals? Do you want to save our hospitals and our people, or just the hospital? Because it pads your bank account. And that's the question at the end of the day. You know? So that's the information that I really wanted to give you guys today. I wanted to shed some light on some of the other things that are happening. You know, some of the other things that are happening to people right in your communities and in your backyards, that this impacts them, this affects them. So if you were one of these people that used to have your care done at one facility and you are now being told that you have to go to another facility and your pricing and your charges are changing, I need those bills. I need the before and I need the after. You need to send them to me. Don't just tell me your stories, folks. Send them to me so that I have legitimate documents that I can give to people who can do something to help us. It's what we got to make happen, okay? My folks that are in Greenville, Tennessee, I'm just now starting to look into what's happening with Laughlin and Tacoma hospitals. I do know that those 2 hospitals are going to operate as one entity with 2 campuses. I do believe that that's also to get 340B pricing, because if you now say that it's one location with one entity with 2 campuses, then all of that falls under one umbrella, which is why you would probably qualify for that 340B pricing. What that means to you all just yet, I don't know, because I don't know. I know one is going to be more like outpatient and one is going to be more like acute care, but I don't know how that's going to break down for you yet, and I don't know what's going to happen with all of your services. So just buckle down. I understand that some of that's coming like now, between now and February. So, you know, I'm sure if you have information on that, legitimate information, legitimate documentation, hit me up. I will give you my secure email and you can send it to me. Okay. So that's really all I have for you guys for tonight. I appreciate you all. For those of you guys who are being brave that are sending me things, I sincerely do appreciate you so much. I know that a lot of you guys, you know, are thanking me and saying all of these other things, but you need to understand that a lot of the digging that I did in the beginning, you know, I have done a lot of digging on my own, but there are other things that people are being brave and people are risking a lot to bring to me. So I want you to know that it is definitely a team effort. I can't do this by myself. You guys can't do it by yourself. We are doing it together, and it's getting traction and it's getting attention, and we have to continue to do it while we have people's ear and attention. Okay. So I'm going to get off of here. Send me whatever you need to send me, and be safe when you're doing so. Don't print shit off, folks, especially not at work. Take pictures. Don't print things off. Take pictures, and then we'll go from there. Okay. So I'm just going to check this out real quick. All right. So I'm out of here. Y'all know how I end it, right? Y'all know how to say it with me. Be amazing, be light, and be love. Peace.